Greetings from Madrid. I'm Anca Moreno, President of Fibrera, and on behalf of the Board of Directors, I welcome you to a new Fibrera Autumn webinar. Today we will present the Fibrera Concovid project and network. As we all know, and probably will always remember, in 2020, the world is experiencing, I'm sorry, but I need to change. Okay. The world is experiencing the worst health crisis since 1918. COVID-19 first made its appearance in China on December 21 of 2019 and spread quickly to South Korea, Iran, and across Europe, when the countries more affected during the first wave were Italy, Spain, and UK. At the peak moment of the crisis in Europe, a group of 3 research teams, members of Fibrera in Spain, Italy, and UK, decided to take the lead to understand how citizens were making sense of the crisis. According to the World Health Organization, the capacity to relay information quickly and clearly on different media platforms is essential to the effective management of a public health emergency. In risk and crisis communication, channel selections and trustworthiness are also important predictors of information processing and adherence to recommended preventive behavior. Nevertheless, despite a number of warnings from the scientific community and the lessons learned from previous infectious disease emergencies, governments around the world have shown low capacities to respond and communicate effectively to health emergencies outbreaks. Our work got the attention of academics in Europe and abroad, and we were requested to expand the projects. As a result, today, Concovid has become a new Fibrera network, and a second round of studies are being conducted during the 2020s autumn by Fibrera members in Europe, America, Asia, and Africa. Thus, Concovid has become a global research network with empirical data that will allow comparison from countries in 4 continents, as well as singular perspectives like the rhetoric of the crisis in North Europe. It also has already got an impact with publications in key academic journals and further social dissemination, including press coverage and a publication in the World Health Organization webpage. Today, we will present final results from Spain, Italy, UK, and Nigeria, and preliminary results from Romania, Georgia, and China. I'm going to present now first the main insights of the project from the data gathered in Spain. COVID-19 arrived in Spain on January 31st, when a German tourist tested positive in the Canary Islands. The day before, the World Health Organization had declared the outbreak of a public health emergency of international concern under the International Health Regulation. On March 13, the Prime Minister of Spain announces a nationwide state of alarm with a lockdown, and in 2 months, Spain had become second country with the highest number of coronavirus deaths relative to its population. The government management of communication was widely questioned by journalist organizations from the very beginning. The aim of the study in Spain was to assess how information forms and sources were influencing the public information-seeking behaviors, their understanding of the crisis, and the perception of government's communication responses strategies during the pandemic. We grounded in the channel complementary theory, the Jude and Meng, which draws from selective exposure and uses and gratification theories to suggest that audiences select certain types of media based upon the functions relevant to them in a certain situation. During crisis, people actively participate in the consumption of media types, choosing media forms that are more likely to them to serve the functions that are personally relevant for them in that moment. This theory was developed in response to arguments that theorists predicting that the use of some media, particularly the new technology facilitated by the internet, will displace the use of other media, or the traditional media, mainstream media. Channel complementary theory stands in contrast to an earlier perspective that the rise of the internet will displace the existing media of information seeking. An online survey was conducted for data gathering between March 14 and April 14. The questionnaire was constructed on an online survey to deliver invitations through WhatsApp, Telegram, Twitter, Facebook, Instagram, and LinkedIn. And the online questionnaire included questions regarding information seeking, behavior towards different sources and channels, perception of government communication management, message retention, and psychological and demographic questions. Data were split between the first and second fortnight to respond to 5 hypotheses on media use, relation between media use and assessment of government communication, relations between time and assessment of government communication, relations between assessment of government communication and response to crisis, and relations between time and public authorities' trust. Our results, very brief, are that hypothesis 1 was partially confirmed. 3 of the 4 most used information channels are considered mainstream new media. However, the second sources of information was WhatsApp. Television was the first and WhatsApp was the second. So results show that citizens might asynchronous use of multiple media and platform, and no new media have displaced mainstream media. Results also partially prove hypothesis 2. People who relied more on the mainstream media, mainstream news media for COVID-19 information were generally most likely to express positive opinions of the government's communication strategy. Results also corroborate hypothesis 3. As expected, criticism of the government was more moderated during the first stage of the lockdown, the month, and this confirms previous literature of crisis communication that state that criticism of citizens increase when crisis evolves. Nevertheless, in a certain way, people more critic were also the less informed. The results corroborate also hypothesis 4. People less able to make correct attributions to governmental information were also the most critical to the government crisis responses. Finally, regarding trust in public authorities, in the first month of the lockdown, the government was a highly trusted source for half of the Spanish citizens. However, the detailed comparison between the first and the second fortnight partially proved hypothesis 5. Trust in public authorities, except for local governments, declined, with the largest and more dramatical drop for the World Health Organization, what in the first moment was the most trusted sources. Our research has some implication for theory, methodology, and practice for risk emergencies and crisis communication. I will summarize then in the evidence that crisis communication professionals need to be in the decision tables of authority bodies because their competencies are essential now to manage this unprecedented global health crisis. You can find an OPEC access to a full paper of the Spanish results in the Opera web or in my personal research engage account. And thank you for your attention. And now I will give the floor to Stefania Romenti to know the results from Italy.
Thank you, Angeles. Thank you so much. So I share my presentation. So. And welcome to everybody. Thank you to be here. I'm Stefania Romenti from Italy, and I will present some results, some of the most interesting results about our research. First of all, I want to thank you, the team of researchers in Italy at University that collaborated to this research. So together with me, Grazia Mortarelli, Elanor Colleoni, and Mirko Olivieri. I decided just to select the most important and the most interesting results from Italy. So I wanted to skip methodology because it is the same methodology that also Angeles presented before, and the results were collected in the same period, so March and April, and we collected more or less 470 questionnaires and responses from Italian respondents. So first of all, which are the most interesting results that we have collected? First of all, we have seen that traditional information outlets are those more proactively consulted by people. So as you can see, TV and online newspapers are the most proactively consulted by respondents, while social networks are used less than traditional media in order to collect information and in order to find information about coronavirus. The second very interesting result, in our opinion, is that trust is nurtured above all towards institutions and institutional sources. So as you can see, the Italian government, the ISS, which is the Italian Health Institute, and also the OMS, which is the Italian acronym for the World Health Organization, are considered and are perceived as the most trustful sources of information. We have seen that the so-called peers, so for instance, friends or acquaintances, are towards whom trust had grown in the recent years, are considered unreliable, and unless they are health influencers. Then we have seen another important, sorry, so I tried, okay. We have seen also that 50% of respondents recall, we have seen, for instance, we have tried to insert some questions about communication campaigns by companies. So we have analyzed the impact of communication, of some corporate communication campaigns on respondents and on Italian publics. So we have seen then 50% of respondents recall at least one communication campaigns activated by business companies, and most of them, the totality of them, perceive the campaign as authentic. So I think that it is very important result, because that is a very important result because during coronavirus, business companies, so many companies offered a lot of very useful information together with institutions and government institutions. And we have seen that two main framing strategies were adopted by the companies, by Italian companies, for these communication campaigns. First of all, the first strategy was so-called the best for strategy. So above more or less, 49% of companies, of Italian companies, tried to communicate in order to do the best for the society. So they tried to promote just community values. Sorry, can you switch off your microphone, please? Thank you so much. And they tried to promote community values and to promote appropriate social behaviors in order to do the best for the society. The second CSR framing strategy adopted by Italian company to communicate about coronavirus is so-called the best of strategy. So in this case, the goal of the campaign was to make the company appear as the best within society. So just to highlight the social and economic support that the company was offering to society, and just to inform people about the services, about the products, about the support that it was offering to society. For what concerned the reactions of publics and respondents to corporate communication campaigns, we have analyzed the most widely used words to describe the communication campaigns, and we have seen that most of the respondents used the word donating. So in order to highlight that a lot of companies were trying to find resources and funds to help victims of coronavirus, but also health association, hospitals, and so on. Finally, I want just to show you the final results and the final elaboration. We have analyzed results throughout a cluster analysis, and we have found two very distinct groups of publics. First of all, the group one, the group with two distinct groups with different, they used the media in a different way. They had a different level of trust towards social bodies, for instance, and they evaluated in a very different way the quality of government communication. So, for instance, we have seen that there was a group one. Group one used above all Instagram, online news, and the group two above all Facebook and the radio in order to collect information proactively. And then we can see that the group one had just trust in some social bodies, such as government, World Health Organization, and Higher Institute of Health in Italy. And while the group two had average level of trust across all political and social bodies. But we can see that at the end, the evaluation of the group one is completely different about the government communication, because for people belonging to group one, government just generated social alarm, so they evaluated very negatively the communication done by Italian government, and the group two was for the group two, the feedback on government in communication was more positive, because they think that the government communicated promptly and clearly. If we look at the words that the two groups of people use to describe the corporate communication campaign, we can see that the first group, for instance, used more rational words in order to describe this campaign. For instance, above all donating, but also informative, effective, direct. While the second group used more emotion-related words, such as supportive, sensitized, impactful, but also value-driven. So they perceive corporate communication campaigns by Italian companies in a different way. Finally, just to conclude, they recall the campaigns, the best of and the best for campaigns at different levels. For instance, the group 1, which was the group that evaluated more negatively the communication by government, and the group 1, which was the group of people which described the corporate communication campaign in a more rational way, for instance, they recall more or less above all the social and economic support campaign, so the best of campaign, and the informing campaign, for instance. While, for instance, we can see that the group 2 neglected the informing campaign and were much more focused, and they recall much more the best for campaigns. So the campaigns in which the companies tried to highlight their role in the society, but above all for the society. So the support and the to promote the community value and the support for the society. Okay, so thank you so much for your attention. And if you have any question, I'm here and I can answer to your question later. Thank you so much.
Thanks, Stefania. We're going to go on to the third of the initial research projects that was conducted in the spring of this year, which is ours from the UK. My colleague Gemma Bridge will talk through our findings shortly. Thank you. For a couple of colleagues have already started to use the chat and the Q&A section. As Stefania has just mentioned, she's happy to answer questions, as we all are. We're going to, ours will be the third of the preliminary studies, and then we'll be looking into the studies that are now ongoing and some of those that have moved on since then during this COVID pandemic. Please use the Q&A function to drop your questions in, and we'll endeavour to try and answer them all at the end of this webinar. If we run out of any time, we'll answer your questions still, but we'll respond afterwards, possibly through the UPrera site as well, to any leftover questions we don't get to. But without more delay from me, I'll hand over to my colleague Gemma, who's going to talk from the UK perspective, what we discovered when we did the similar study as Spain and Italy. So Gemma, are you there?
Okay, so as we've said, the UK was one of the first European countries to experience the COVID outbreak. The first case of coronavirus occurred on the 31st of January. And then after that, we entered the national lockdown on the 23rd of March. Following that, we reached the peak, as you can see in the graph on the right-hand side there, in the middle of April. And that's when we reached this first peak with the most deaths. We carried out the research during the peak and just before, so it was kind of right at the beginning of the pandemic for most countries. So as has been said, the aim of the study that we carried out was to assess the UK government's communication management of the COVID crisis. We were looking to explore the most used channels for information receipt and searching, the most credible or trusted sources of information, the types of messages that were received and remembered by members of the public, and also the effectiveness of those messages. So how well were they acted upon and how were they perceived in that respect? So the method which has been described was an online survey. We shared this during the first 3 weeks of the UK lockdown in March. We recruited via email and social media. We also conducted a paid advertising campaign via Facebook to try and recruit some more people from different areas and different demographics. The survey was completed by 609 adults from across the UK, although most were from England. And the data was analysed quantitatively, looking at descriptively, and then also the qualitative data was analysed thematically. The key findings from our survey were that the key information sources were TV, social media, which was Facebook, Instagram, and Twitter, and online newspapers. Those sources were used to research for information and also to receive that information. The trust in information was relatively low in government and media in general, but was highest in information shared by health staff and health organisations like the World Health Organization. Health influencers, however, had low levels of trust. Government communication was perceived to have been implemented, the policies described by government were perceived to be implemented too late, generate alarm, and confuse the population. However, despite this, key messages like hand washing and social distancing were retained. So, looking over this and reflecting back over the survey and the surveys from Italy and Spain, we noted that the government were not the most trusted source of information. In terms of the COVID crisis, this is particularly interesting and also important to consider, considering the fact that they were sharing theoretically the most important information. And it's also important to look at where the information was coming from. So a lot of the information was received from online sources. This is potentially adding to confusion in terms of the amount of information being received. And despite this, the actions or policies implemented by government were perceived to happen too late. So based on the findings from our survey and also those from Italy and Spain, which were the other two during the first wave of the pandemic, we could consider questions such as, how has the lack of trust in government communications affected the public's likelihood to follow the guidance provided? And how should the findings shape future public health messages? Okay, I've kept mine nice and concise so we can pass on and have time for questions at the end. There we go.
Thanks, Gemma. So we next have on our agenda, we're going to hear from Nigeria. Chinedu, are you there? Is he with us?
Ral, I think we have to reboot the audio. It's audio. I can see him now. Okay.
It's frozen, I think. No. I think he's having connections problems, isn't he, by the looks of it?
But I can see his screen, but
yeah, I can't see. There's no movement.
Okay.
Should we maybe just pause and move on? Should we move on? We could go to Juan. Juan, do you want to give your presentation on China next instead? And we'll, if we get reconnect, we can change the order. Is that okay?
Yeah, that's okay. Absolutely.
Okay.
Let me share my screen.
So I'll hand the floor to you when you're ready. And so we're going to now hear some of the preliminary results from China.
Hello.
Oh, he's back.
Okay, then I'll stop sharing.
Hello.
Hi, are you back?
Yeah, I'm really sorry for this. I'm having a connection issues.
No problem. We all face that.
Yes, I'm trying to connect to my laptop. It's having an issue, so I'm using my phone now. I don't know if Angelus could share the slide I sent to him. I can see. Yeah.
Sure.
Hello. Okay.
Okay.
Yeah. Hello. Good afternoon, everyone. I'll be presenting our own survey from Nigerian perspective. In Nigeria, Nigeria had its own share of COVID-19 issues, just like every other countries. And sometime in March or in April, we decided to conduct a survey. And the survey is on COVID-19 communication management survey in Nigeria. So our aim was to look at how the government communicated the issue of COVID-19 to Nigerians, and for Nigerians to assess the government communication. So, but before I start, I have to state one or two important points for us to look at. Nigeria recorded the first case of COVID-19 on the 28th February 2020, and it was an Italian citizen who just returned from Italy that first tested positive in Lagos. So after that issue, on 30th March 2020, the Nigerian government, through the president, declared a national lockdown to contain the spread of the virus. Currently, we have about 65,457 active cases, confirmed cases, and then 2,957 active cases. So far, the Nigerian government has discharged about 61,337 cases. And then the death rate, which is relatively small in Nigeria, it's at 1,163. This was as at yesterday. This next slide, please. So on 5th April 2020, I and the research team, we launched the online survey on COVID-19, and it lasted for 2 months, from 5th April to 5th of June 2020. And at the end of the day, we had 960 responses. Next, please. So specifically, we were concerned about the preferred media of COVID-19 information by Nigerians and the sources of information that Nigerians trust most. Number 2, we looked at the people's view on government communication on COVID-19 and the opinion on the government communication compared with other nations. And then the final one, we looked at what could be done to improve the government communication to the public on COVID-19 and other future pandemic. So next please. So preferably, I decided to show this particular interesting findings. From Nigerian perspective, most of our respondents agreed that they prefer the social media, and the social media include Twitter, WhatsApp, Facebook, and rest of them, followed by television, broadcast media, and others. Next slide, please. And for the trust they have in information sources, for Nigerian public, they prefer hearing information about COVID-19 from World Health Organizations and other health associations. In Nigeria, the masses, the Nigerians don't like hearing information from government because they don't trust the government. Next one, please. Next. That's the graphic illustration. Then in terms of perception, in Nigeria, our people don't perceive whatever information the government is giving to them. So they feel that the government itself is not telling them the truth about COVID-19. So when you look at the figures, you see that majority of them feel that the government has not revealed all the truth, whereas others feel that the government is confusing the population, looking at the different information from different sources and people telling public different types of it from different government officials. So they feel that the government was not telling them the real truth and government is confusing the masses. Okay, majority of them also feel that whatever information the government gave during the first period of the COVID-19 generated a lot of social alarm. So there is a clear case of lack of trust in whatever messages the government pass across to the public. Next, please. So in terms of perception on government communication message on COVID-19 in relations to other nations, Nigerians feel that the government has not done any far better than other nations. And it is their view that 69.37% feel that the Nigerian government has been worse than other nations. So there is that issue of trust because the masses, the citizens of Nigeria seem not to trust the government communication on this. Next, please. As an illustration. Next. So how to improve government communication? We asked them a question. Okay, if you don't trust the government, what do you think the government can do differently for them to earn your trust, especially on COVID-19 and the future health crisis? So when you look at this, some of them are ranging on the government should be more transparent. The government should be honest. The government should employ communication experts, people who understand what communication entails, to communicate, to have an interface with the masses. By doing this, the government can, government message can be perceived to be trustworthy, can be perceived to be transparent, and people will be moved to do what the government has in mind for them to do. Next, please. Thank you. Hello. Yeah, thank you very much. That's all for Nigeria.
That's the Nigerian perspective. So, Juan, do you want to take your next China presentation for the floor? Are you ready to go?
I'm okay. Okay, here's my screen. So are you able to see my full screen?
Yes.
Okay, good. So good morning, everyone from Athens, Georgia in the United States, and I'm Juan. And on behalf of the China research team, I would like to share some preliminary results with you today. And my research partner is Professor Zhao Wang at Shanghai Normal University in China. So the time frame that we used to conduct the data collection after joining the covic project that was launched in October, early October, and we took about 5 weeks to finish the data collection, which was just wrapped up last week. And we used the convenient sampling strategy and the snowballing sampling strategy to try to increase the reach of our survey to get a much better completion rate across the general population. So we distribute survey by using anonymous survey link as well as create the QR code and distribute through the smartphone, especially the WeChat app, which is the most popular app, social media app in China. And we also kind of try to increase the quality of the survey by limiting the respondents must be 18 years old to be qualified for this study. And the general population, people who lived in China, especially during the year 2020, were the major one that we recruited. So after we finished data collection, then we were able to track about 2,271 clicks of the survey that we send out through either emails and the smartphone apps. And eventually, after the data cleaning, we were able to recruit 1,719 complete responses. And because we are still in the final cleaning phase for the data, so the final response might be more or less a little bit that I will keep everybody updated. So these are some key demographics that we controlled at the beginning of our survey, including ask about their employment status ranging from full-time all the way up to retired, the senior citizens, and also control the gender, age, their educational level, and also since China is quite big in terms of geographic span, so we asked the geographic location by province to see different perspective from different provinces as they were affected by the pandemic. More or less, as well as their income level. So these are the key questions that we kept to recruit during the survey to be consistent with the overall the global survey, but we also adapt to different levels to fit the China context, especially people's perceptions. Without try to reduce their bias in terms of the informational channel and the government communication, we asked them about their knowledge of COVID-19 first to try to control the potential primary effects that can come through different channels, source of information, and key messages that they retained. And here's some very quick snapshot of results that we were able to retrieve from the preliminary research analysis. Okay, we asked about does the COVID-19 outbreak affect you personally? And we asked them to evaluate the 4 statements, such as I pay attention to the news, the COVID-19 outbreak is a heavily discussed topic in my country, and the COVID-19 outbreak is relevant to my daily life and work. And the last one is that the COVID-19 outbreak affects my daily work and life. And based on the 7-point Likert scale, we can see the mean is pretty high. They pretty much agreed overall across the 2,000 respondents, COVID-19 heavily affected their work and life. Then we tracked down how much and attention or how closely they have been following the news about COVID-19 in the following 4 time frames, because China was the very first country that reported the cases and experienced the outbreak of the pandemic and linked to the lockdown as one of the earliest country in the world. So we tracked down by first quarter, second quarter, third quarter, and fourth quarter. And the chart on this preliminary results slide showed the red line indicating the first quarter. And you can see at the very end means they were closely monitoring to a largest extent. And as time goes by the time we recruited the respondents, when we were in fourth quarter, their attention level significantly decreased to not concerned or not following the news at all. So that shows overall the national trend in terms of the, how closely have they been following the news. And related to their attention to the COVID-19 news, we asked their concern level. How much are you concerned about the impact of COVID-19? Similar trend revealed as related to how much attention they have been giving to the COVID-19 news. First quarter, during the outbreak, the pandemic, and also lockdown time, they were extremely concerned, the majority of the respondents. And as we finish our data collection in fourth quarter, their concern level decreased to the lowest level, not concerned at all. So several questions related to the source of information and also channel of information that they use to receive the COVID-19 related knowledge and information. And the number 1 rated or the trust level, the highest trust level is from the public health organization and officials. That is pretty much consistent with other research teams from different countries. And interestingly, they ranked the central government official as the 2nd highest trust level of source, and followed by the state level and the local level, then friends and family. And quite interesting that they use the social media and the internet a lot to receive information. But however, the trust level about those social influencers, bloggers, and the KOLs were the lowest one among the other sources of information. Then we asked, one of the very interesting findings we asked is about the key message they were able to retain during the time of lockdown based on the government communication, which is during the first quarter from January to March. And the top 3 key messages they were able to retain based on the government communication is, the very first one is about COVID-19 spreads easily and you must stay at home so that the economy does not suffer a longer interruption. The top 2nd one is about COVID-19 is dangerous and the border should be closed. The 3rd message that they retain during lockdown time is about COVID-19 will cause a state of emergency. And the most important thing is to keep food and other essentials at home. And then compared to the lockdown time, the post-pandemic time, which is now, as of now, from October until now, the top 3 messages they were able to retain through the government communication and different campaigns include wash your hands often, cover your mouth and nose, and keep social distance. And also strictly implement prevention strategies to avoid having another waves of the increased cases. And then lastly is avoid traveling to areas currently experiencing the coronavirus pandemic. So these are all the government communication messages that we retrieved from the National Health Commission of the People's Republic of China. And these are kind of very quick overview of some of the interesting preliminary results. So stay tuned and more results are on the way. Thank you for your time.
Excellent. Thank you very much. That's perfect. So next we have a discussion from Romania. Anca, are you presenting for Romania?
Yes, I am. Thank you. I'm sharing my screen. Okay. All right. So hopefully you can see it. All right, so these are our preliminary results. Basically, in Romania, we had our first confirmed case on February 23rd. We entered our lockdown on March 11th, and it carried out through May. We are currently in the middle of our second wave. We reached about 300,000 cases, 10,000 deaths. Well, basically, we'll see how it goes. What we did was we joined the COVID network for the second step, and we see, yeah. So we did the data collection during the month of October. We disseminated via Facebook, because basically that is the social media platform that we use the most in Romania. We collected around 1,000 answers on various social demographic variables. What I can say that from an age point of view, we managed to match either the Romanian population by age or the Romanian population on Facebook by age. Now, regarding our preliminary results, we pretty much followed the main interest areas of each of the other countries, so we'll have a good chance to compare. I've been looking at the other results. So basically, in terms of media used to obtain information, we obtained similar results to the ones we've seen. We divided the ones that were primarily used as sources for information. We divided them into 3 tiers. The first one was online press and TV. So basically, let's say traditional sources. And then in tier 2, we could see public institutions, their website, their blogs, and Facebook, basically a very institutional source and a very democratic, non-regulated source. Now, in terms of government communication, basically the evaluation of how government communication was carried out, we had 3 positive statements, 3 negative statements. What we could see was that there was a disagreement with the positive statements on government communication and agreement with the negative statements about the government communication. So while no major position or stance on this was taken, as the values are rather in the middle of the scale, there is a clear indication of dissatisfaction. Now, it will be interesting to see, as we explore the data a little bit more, if there are any variations based on socio-demographics variables, but this is the preliminary data we have. In terms of government messages, what were the government messages that were retained? There were 3 that clearly stood out. And what we found out was that there was a dominant, main theme in these messages, which was protection on various levels. Protection from external contamination, protection for vulnerable groups, and protection from misinformation. And in this last instance, the authorities projected themselves as the protector. So that was those are some findings in terms of government messaging. And next, moving towards trust in information sources. What I would like to first point out is that just a comparison with the results from our other colleagues, we do have similar trust levels in information sources, but the trust for these information sources is lower. The level of trust is lower in Romania. For example, we never reached 5 on a scale to 7. So our highest scores are associated with low scores for other colleagues. But other than that, there were some clear standouts, and we divided them into 2 tiers. The first one was prestigious healthcare personalities and the World Health Organization. The second one, medical professional associations, people transmitting personal information from inside the health system, and the presidency and the government. So overall, we could see a general lack of trust, and now seeing the results from other colleagues, a lower level of trust than in other countries. We saw that, and this was encouraging, the most credible sources are medical, science-based sources. Even across tiers, we see that the first 3 sources have a science background. We saw, just as other colleagues, that friends on social media are not considered to be credible information sources. And while first-hand personal experience is the most credible non-medical source, it is surpassed by medical expertise in terms of credibility. Another dimension that we explored was what COVID-19 information our respondents considered to be true. Basically, we gave them a lot of statements that circulated in the public sphere. And what we got out of the preliminary data is the fact that the main government messages are considered to be true. That the common sense, balanced, non-alarmist, informed perspective is preferred or prevalent. That there is dissatisfaction with government actions, which are considered untimely, unbalanced, not adapted. And another interesting thing is that conspiracy theories are present, but are rather fringe. So this actually led us to a question whether social tension, well, basically if social tension is created by alarmist media, inefficient government and inefficient government communication, and fringe but loud voices. So basically this is the preliminary information. I try to keep it as compact as possible, but I am very much interested to go a little bit more in depth in the data and to compare with the results our other colleagues received. So thank you very much for your attention.
Anca, thank you. That's excellent, and some clear parallels emerging from all of these studies. And I think we're now on to our last one now, I think. So Leli from Georgia, are you able to share your screen okay?
Yes, now I will share my presentation and go through preliminary results of Georgia. So we represent, our team, 3 of us worked on the research project. So results that today we are going to present are the preliminary results of Georgia's reality and evaluations of respondents. So first of all, I will make a very brief overview. The first cases of coronavirus were observed in February, and for the first wave, there was really few cases. That was about 15, 20 was the maximum quantity, but still we had some lockdown in the country. Government announced lockdown, and in that way it was prevented somehow. But nowadays the quantity of coronavirus cases is increased. For example, nowadays in 24 hours we have approximately 3,700 cases. So now is the most critical part and environment in Georgia, and we did not have that kind of crisis before, as it was, for example, in Europe. So regarding the demography of the respondents, so now for as I already mentioned, the data that we have here is preliminary data and preliminary analysis. Already by now, 430 respondents were surveyed, and to make a brief overview of demography of our respondents, the age of our respondents who fulfilled the questionnaire is mostly from 18 to 45. The majority of them is in that age category, but we also have people from 40, 60 to 65. So mainly the respondents are from the capital city of Georgia, and most of them are employed. So regarding the main sources of information that they where from they get the information about COVID-19. The main sources are online media, and social media, that is Facebook, and from the traditional media, they also are active users of television and online press, online media. So I want to just make some comments about this, that to compare the results with previous research data, it's noteworthy that so Facebook, social media in general, and television were also, before pandemic situation, the most actively used means of communication in Georgia. But nowadays, due to the pandemic situation, websites related to health and websites of public institutions became one of the most used channels for obtaining information as well. So the second objective was to assess the evaluation of government communication. In these terms, we have very interesting finding that on one side, on one hand, people assess that the communication was somehow effective because they were always getting information in appropriate times, and all the messages that the government was trying to communicate with the population was quite clear and sufficient. But on the other hand, we have the issue of trust and credibility and reliability of the messages. So to compare to the real situation, this data, one thing is that government prepared, designed a special website where people can obtain and track daily cases and get information on COVID-19, and also they have on daily basis active briefings where they inform people about the ongoing situation. But on the other hand, people have more, as I already mentioned, have more the issue of credibility, and they trust less the information that the government distributes to them. Regarding the messages that they remembered, and the main messages that they perceived were the main and the most important that came from the government communication, was that they remembered that in order to minimize the spread of COVID-19, it's important to maintain hygiene and follow the guidelines provided by government, like social distancing, washing hands frequently, wearing a mask, and so on. There was so some other like messages were not that much remembered by the society, and just few of them, for example, emphasizes that it's important to stay home to protect elderly and sick, and that you must stay home so that economy does not suffer a longer interruption, and so on. So the main point was that they remembered these three things that came from the government. And it's also very logical because the main messages during the campaigns that were organized by the government was highlighted in this direction: to keep social distancing, to wear masks, and to wash hands frequently and follow this type of guidelines. Regarding the most trusted sources of information that Georgian people perceive to rely on, is that they mostly consider the most reliable sources of information health personnel that they personally know. They also consider to be the reliable source of information WHO, World Health Organization, and local associations of health groups like National Healthcare Association, that is the local one. And also prestigious healthcare personalities like those who are very very famous and those who are well known for the society, local like doctors and local professionals. So we also tried to somehow differentiate information that people believe, and to differentiate this in terms of myth and harmful information for them that they believe to be true, and the information that really is true and they believe that they should follow and follow these messages.
Leli, can I just interrupt? We're going to run out of time if we're not careful. I just wondered whether you could summarize, just so we don't get timed out.
Okay. I will just, yes, I will just point few things. So regarding the dominant harmful opinions that people have, so they believe that COVID-19 only affects elderly and sick people. So that is one stereotype that is mostly spread in society, and they believe this to be true. So positive opinion and positive message that they believe is that they should follow the guidelines of provided by healthcare associations and organizations, like washing hands and keeping distance, and specific opinions that are very characterized to Georgian people, that is the mostly like spread information is in this direction, is that regulations imposed by the government causes the education system to collapse, restricts the availability of the educational resources. And the second one is that these regulations ruins the economy and decreases the level of poverty and causes the businesses to collapse. So these are the main points that during the preliminary research we made this kind of findings, and we continue the research, and I think that some more interesting findings will be available. Thank you very much.
Can I thank everyone who's presented, and also offer a quick apology. We were always ambitious with our many studies from different locations around the world, so we had a lot to get in. We have questions, and we're going to respond to those questions possibly through the website. We'll try and hold on to the question panels, and we'll respond to them. Thank you everybody who has been firing those questions in. They're much appreciated. We only have this hour slot. We've slightly overrun, so I'm really sorry that we're going to have to probably close down in the worst of interactive teaching style this opportunity, because I know people will have to leave. But it was great to have you with us. On behalf of UPrera and the board, thank you. Thanks to all of our teams who presented what is effectively really fascinating and ongoing research that you'll see hopefully more about and hear more about on our site for UPrera. So we will be continuing to run this network of research and to share the outputs of the network and the research with you. Again, please feel free. You have many of our direct contacts to come back to us if anything hasn't been explored or explained to your satisfaction. We will obviously try and do so. But again, thanks everybody for joining us, and we shall see you again to another webinar with UPrera. So take care, keep safe, and speak soon. Bye-bye.